the new Justice and Opportunities Department. Thank you so much for kicking off the recording. We are going to be recording the session. We do hope that as many of you as possible, when you're talking or around, feel comfortable joining with your screen on, but it's not required. Like I said, I am Jessica with the new Justice Care Opportunities Department, and I'm thrilled to be welcoming today Megan Medlin from Medlin Workforce Reentry Solutions, who we have invited to share findings from the last almost year of work that she has been doing with us, funded by the Prop 47 funding stream and supporting our sector program Skills and Experiences for the Careers of Tomorrow around employment for system impacted individuals in LA County. I'm particularly glad that this is going to be a mixed group. We really wanted this to be available, which is why we're recording it to the larger LA-based reentry workforce community, because we know that the findings and the valuable research work that Megan's been doing can be useful to all of us beyond just the sector providers, although of course that is our primary audience. And so with no further ado, I'll just say it was a real joy working with Megan, and I'm excited for this presentation. And there will be time for questions. And in the meantime, if things come up, feel free to throw them in the chat. But thank you so much, Megan, and welcome.
Yes, thank you so much, Jessica. And welcome everybody. I'm excited to be here with you guys today and go over kind of like, as Jessica said, our findings of close to the past year. And I am doing double duty. I'm keeping an eye on the waiting room, so I'll be sure to let people in also. But let me go ahead and share screen. You guys should have also gotten this ahead of time in the invite. We will send it out again, just to make sure that everybody has copies of the slides. So to make sure, sorry, double duty on this waiting room here. Okay, so what we're going to go over today, give you guys an overview of the project in and of itself. So what have we been working on? Specifically, like why healthcare? So why was this field chosen, and what are some of kind of the opportunities for individuals in this field? Some of the key findings from this project. Career pathways within healthcare that are going to be advantageous to individuals who are system impacted. The occupational licensing process. Some recommendations, and then as Jessica said, we'll have time at the end for Q&A and then kind of some peer learning. The admit doesn't let me go through. Okay, so to start with, for those that aren't familiar, this project started with Sector. So Sector was or is under ODR, now known as, I forget your new name now, but previously known as ODR. So we will be
Justice Care and Opportunities Department.
Perfect. So we will be referencing ODR today because that's who it was through, but they do obviously have a new name. But they are partnering with the Sector program to identify career opportunities within certain sectors for individuals who are system impacted, with the goals to increase employment opportunities, increase earning potentials, reduce recidivism rates, and just improve overall behavioral health and well-being for individuals who are system impacted. And so our specific sliver of this project was within the healthcare industry, even more specifically within clinical healthcare. Every time I click out of the screen, it doesn't let me go through. So our overall project goals was really just to learn about the hiring needs of the healthcare industry. So what sort of pathways are there for individuals who are system impacted? What sort of barriers and restrictions are there out there for people? Identifying key employers that pay at least $21 or more and who have possibly experience or at least interest or openness to hiring individuals who are system impacted. And then starting to build relationships for future partnerships with ODR and sector organizations, so we can start developing pipelines for these employers of employees through this program. So how do we do that? So our phase one of the project, which was earlier this year, this is kind of the bulk of our project. We were doing a landscape study of the healthcare industry. So we were conducting one-on-one engagements with healthcare employers, specifically within 5 territories, which I'll go over in a little bit. But we were contacting them to learn more about what sort of positions they have in highest need right now. What do they pay? What does the hiring process look like? Are they open to hiring people who are system impacted? If so, what does that look like? And then we put together a brief of our findings, which we can also share out with everybody who doesn't have it yet, our initial brief. That goes more in depth specifically on those employers and kind of what we heard from them. And then just identifying like practices or policies within the healthcare industry specific to this population. Phase 2, we were conducting industry discussions. So we specifically had a workshop for healthcare employers. So ones that we identified from phase 1 that would be viable partners for this project. So ones that paid more than $21 an hour, had a variety of open positions, especially entry level with career pathways, and who were open to hiring individuals who are system impacted. We then moved them on to phase 2, and we had them come to a workshop where we specifically talked about like fair chance hiring and what were kind of benefits to that. And then we helped answer any questions they may have had or concerns about hiring individuals. And so we'll share a little bit about that today as well. And then we also did outreach to training partners. So not just the employers, but now we actually talked to the training partners and education partners out there to see any barriers that they may have to individuals even getting training. So it's great if employers are open to hiring them, but if we can't get them training, that's another barrier. So we were doing outreach to these training partners and then starting to create relationships with ODR. And now we're in phase 3, where we're doing our final report out and presentations and then recommendations for these partnerships. So why healthcare? Why was this chosen? Some of you guys may or may not know, healthcare was actually one of the hardest hit industries since the start of COVID. So they've actually lost an estimated 20% of its workforce, including 30% of nurses. So healthcare is hurting right now. We definitely felt that over the past few months, just even in our outreach and trying to contact healthcare employers. A lot of them have quit their healthcare jobs, whether it's stress or for competitive pay. There was actually quite a few that have quit due to vaccination reasons. So if they did not want to get vaccinated, there's also been turnover because of that, but just at a high level of burnout. So again, there is a huge, but just at a high level of burnout. Is that me echoing? I'm not sure. Okay. And then over here, you guys can see, we kind of pulled out some stats that are happening nationwide. In Michigan, there was a health system. They're actually using recruiting firms to bring in over 500 nurses from the Philippines to help fill their hospitals. We did hear from a lot of our employers here in Los Angeles that they are using recruiting firms. We hadn't heard of any bringing in people from like overseas, but it just goes to show you like the huge need that's currently in the industry. So not including COVID, here's the actual projections within LA County from EDD. So from 2018 to 2028, the fastest growing occupations, the #1 occupation by far, as you guys can see, is personal care aides, which includes certified nursing assistants, the CNAs, home health aides, which are typically easily accessible entry-level positions. So we really explored potential barriers, since that is a licensed position, to see what barriers our clients may be facing. You'll also see in these top, there's occupational therapy assistants, physical therapy assistants, respiratory therapists. So a lot of healthcare are in the fastest growing occupations. And then nationwide, healthcare is expected to grow 16% from 2020 to 2030. All of these stats, though, are not taking into account COVID-19. So the fact that you guys saw those numbers previously, how bad the healthcare industry has been hit, none of that is in these projections. These projections are just based off historical numbers. So as you can imagine, a lot of healthcare industry, there's going to be a much greater need across the board in many of these positions. And so that's why this project was even more interesting, right? Is there's this huge need, and how can we get these individuals who want jobs, who are typically not able to access this industry, how can we get them into these positions? Training it. So specific job openings just in LA, again, personal care aides is the #1 job opening. So there is a huge need out in the county. And so that's something we're going to talk about today, is kind of what does that position actually look like, and what are some of the barriers to hopefully start getting clients into those positions. Some of the rest of these positions are like typical entry-level positions. Some of these do exist within healthcare. For instance, we did hear need for like food workers, food prep, obviously office-related positions, cooks, janitors, which are like environmental service aides. So those aren't the positions that we targeted in this project because we targeted specifically clinical positions, but there is still a huge need for all entry-level positions, especially within healthcare. So some of our key findings, in the beginning of our project, again, when I was saying we were doing the outreach to employers, we were conducting what we called screenings, and the screenings is what I was sharing where we were asking about what are their hiring needs, how much do they pay, what are their process for people to apply. We ended up conducting screenings with 38 individuals, which represented 35 different employers. 79% of them we conducted full screenings and 21% were partial. The difference between full and partial was if somebody wasn't able to answer at least one question or more, they were considered a partial interview. The majority of the ones that fell in partial was when we started getting nitty-gritty, like what does your hiring process look like for system impacted individuals? That's where people were kind of got like, we don't know, or we'll have to get back to you kind of thing. And so we did do follow-up. There was a couple that ended up getting those answers for us. What we were kind of learning though was I think some of those employers were doing kind of the HR answer where they were not going to get into depth telling us specifically what would or would not qualify for that. But we did get the majority of the information from the majority of the employers. As you guys can also see, we had a good range of employers from micro to large. So micro being 1 to 9 employees, all the way on up to 250 plus employees. We were able to talk to employers across the board. So it helped give us a really good full picture of what the hiring needs are out there, from small employers who don't hire too often to the larger employers who are constantly hiring. The locations that we looked at, these are our 5 territories. I do want to note the territory 3, which was Covenant House. They were originally a sector partner, and then partially through the project, we're no longer a sector partner. We still included them in our study in our territories because they overlapped with territory 1 and 2, and we're close in proximity to territory 4. So you guys can see the majority of the employers we spoke to were in territory 2, which is roughly a 10-mile radius around Chrysalis in their main location in downtown. Some of these numbers, employers had maybe one location that intersected territory 1, 2, and or 3. Some employers did have multiple locations within those territories. So that's why those numbers are a little bit higher, because there was a little bit of crossover. However, we did want to point out, as you guys can see on here, in order to get these 35 screenings, we had reached out to roughly 234 different contacts representing 157 different companies. There was probably over 700 touch points just to get these 35 screenings. And kind of note was us coming into this project, we had a lot of healthcare relationships already established within healthcare. We had challenges even contacting our own contacts. There's been a lot of turnover, so people actually leaving the industry, leaving the positions. Even within our screening from phase 1 to phase 2, we had conducted screenings with like an HR contact, and by phase 2, they were already out of the industry completely. And so just another, we're kind of tagging that to say like these relationships with these employers are extremely important. And also the fact that you guys should be developing relationships deeply within these employers. So not just with one contact, because if that contact leaves, then you guys are losing your entire relationship with that partner. The other reason that was difficult to get a hold of people is they were just understaffed and overworked. So we would get a hold of people and they would be like very interested, but just apologetic. Like, we just do not have time to even talk to you, maybe later or something like that. And so we'll talk about kind of recommendations, but just to emphasize the persistence that you guys are going to need to be able to really delve into the healthcare industry right now. So some of our findings, hiring needs. The majority of employers hire year-round, which is mostly to be expected. This wasn't too surprising. The employers that were smaller are the ones that tend to hire on a need-based reason. And obviously, if you have 1 to 7 and 1 to 9 employees, you're not going to hire that often. And so this wasn't too surprising on our end. As far as background checks, the majority of employers shared they do run background checks. A small portion did share that they do not. Some say it depends, it's case by case. Of all the employers that we spoke to, there was only 2 that explicitly shared that they would not hire somebody who has a past conviction. Both of these were smaller employers. One in particular, it was kind of an interesting find that they answered all of our questions. And when we got to the point asking about the background, the contact literally whispered in the phone to our consultant and says, our CEO would never hire somebody with a background. And then she hung up the phone. And so I just want to put that out there to say that this is still out there. There's a lot of misconceptions, obviously, about hiring from this population, as well as the laws. And typically, I've been in employment for a long time. Typically, I usually recommend going after smaller to mid-size employers when you are trying to place people, just because they're more apt to change their hiring policies. It's kind of the flip side within healthcare that we found. So a lot of the larger employers, the Planned Parenthoods, the Kaisers, the Antelope Valley Hospital Healthcare Centers, they all shared that they really are following Ban the Box, and they're really looking at the client as a whole. And so they're looking at when the conviction was, how long ago it was, the seriousness, what have they done since then. There isn't like set matrices per se. They really are looking at each individual employee. So that was promising on our end to hear that like there is a chance out there. Almost all of the employers mentioned their high turnover rates right now. Just again, it's really extremely hard to get candidates in, competitiveness of pay. So even if the ones that are paying more, they were sharing that individuals can go out and get jobs, say at Del Taco, for getting paid the same amount. And it's a lot less stress. They don't have to go through health screenings and background checks and all this sort of stuff. So again, our recommendation here is to really just engage in that employer engagement and outreach and developing those relationships with the employers, because once you have that trust, hopefully they can turn to you as a resource for hiring. Of note also in here, we didn't necessarily explicitly ask about drug testing. However, the majority of employers do conduct health screenings where they are conducting drug tests, physicals, vaccinations, immunizations, making sure all that stuff is up to date. Of the employers that do that shared that they do drug testing, they all follow federal guidelines, which means marijuana is a no-no across the board. So that is just something I want to share with you guys as well. So whether a client has a prescription or a doctor's note, it is not permissible. So if you are working with clients who want to get into healthcare, just understand that that could be a restriction. If they are using marijuana, whether it's for medical purposes or other, that could be a restriction to get into the field. Another question that we didn't explicitly ask but came up several times is the need for individuals who are bilingual. And we got bilingual in many different languages, from Spanish to Korean to Vietnamese. So if you are having clients who are bilingual, that is a big selling point for employers right now, to be able to get individuals in who are bilingual. So just to tag on that. So some findings from phase 2 and 3. So overall themes that we heard, these themes were from the employers that we brought onto phase 2. On the right, you'll see we did have our virtual workshop talking about recruiting during the Great Resignation. We had met with sector partners to get their feedback and kind of tell them about our initial findings, and the meeting with training partners. Across the board, what we heard is there is a general lack of individuals even inquiring about or applying to healthcare position. So what this tells us is, again, that there's kind of that word on the street, if you will, that people are not able to get jobs in this field. So they're not even applying. We did have, in particular, 2 employers I can think of that had shared, we don't even think anyone with a background ever has applied. And so that they would be open, they've just never hired anybody because nobody's applied. Or if they had, they were very minor things like a DUI that people were had applied and they were able to overlook. So this is something, again, it just shows that we need education across the board, from employers to clients to the training partners, that this is a potential field for them to get hired into. There definitely are some barriers and things we would recommend prior to applying, which we'll go over. But again, there's just a lack of people applying, period. Employers are having an extremely difficult time hiring and would actually be open to considering system impacted candidates. So this was something we heard, especially in phase 2 in our workshop. So when we were asking employers about their challenges currently hiring and what are they doing, we were hearing employers are utilizing employment agencies and paying really high fees for placement. There's extremely high turnover even with those clients because there's not a true relationship between the agency, the client, and the employer. They're not necessarily being screened correctly. They're not necessarily having the skills that are coming in, but employers are doing all that they can. Another employer shared they're paying out sign-on bonuses to try to attract and keep employees. This is something that's unprecedented for the positions that they're paying them for. So again, just to kind of show that employers, there's a huge need out there right now. And so if you guys are able to connect with them and show the value, of the clients that you're working with, I think there's going to be a very good opportunity to get these clients in. Because these employers were even sharing, before we would have never considered these candidates. However, right now, like we're desperate, right? And so it's kind of like, how can we get the people to foot in the door to be able to prove themselves, and then hopefully open up the door to other employers and other opportunities. The kind of other major theme that we got in this phase was that training partners tend to screen out individuals with backgrounds for the sole purpose thinking they can't get hired after training. So we did meet with one training partner in particular, and when we had talked with them kind of about this process, they had shared when applicants apply to their training programs, so say you go to vocational training for medical assisting or for phlebotomist or something like that, they kind of share with them, here's kind of the restrictions that employers have, like here's how challenging it may be, do you want to still apply? And so based on that, a lot of the candidates screen themselves out. And so they think they can't get jobs. And so again, this is another big opportunity to be able to work with the training partners because we're hearing from the employers that they're open to hiring people. So now we got to get training partners on board to say, hey, let's get these people trained, right? And then let's get them into these employers. So again, just another opportunity for partnership and education. So some specific career pathways. Within career pathways, some of you guys may or may not know this, there are dedicated career pathways within different industries. Within the healthcare industry, there are 5 main clusters, which is biotech research and development, diagnostic services, health informatics, health support services, and therapeutic. The majority of clients that we are working with and generally going to get their foot in the door within healthcare is going to be within health informatics, such as medical assistants, schedulers, coders, health support services. So a lot of these are the non-clinical positions. So cooks, servers, community health workers, environmental service aides, which is like janitorial kind of work. And then therapeutic services, which are the nurses, LVNs, that sort of stuff in that field. So within these healthcare clusters, what we are in the process of finalizing, and you guys will have, we are putting together easy two-page flyers that you guys will be able to access, which goes over the career pathway in and of itself. Like, what is this career pathway? What are some characteristics that this pathway utilizes? So if I have a client who's very interested in helping people and wants to work directly with patients, where do they fit? I have somebody who doesn't want to help people, but they love learning and science, right? Like, what sort of pathway do they fit in? So these flyers, they will have potential careers on them, potential earnings, and on the back page, it's going to have specifics to the training that they need, and then if they need state licensure or just to pass the employment background check. So these will be, we should have these by the end of the year, no later than the end of the year, for you guys to actually utilize and to be able to when you're working with your clients. So going over some career pathways, we were going to go over just 3 general career pathways. Like, these are some typical positions that are hiring a lot, as you guys heard. And so CNA specifically, what is CNA? So CNAs help patients with daily living activities. So this includes like bathing, getting dressed, personal grooming, moving patients with mobility issues from their wheelchair to their bed, to the toilet, This can happen in many different settings, whether it's at home, whether it's in a care facility, hospitals, even in like jails and prisons. There's a huge need there. There is a program which we had researched, it's back east, where they are currently training people who are in prison to become CNAs, and they're helping in prison with the aging population in prison. So there's certain things they're not allowed to do, like do injections or anything with like bodily fluids or anything like that, but they are able to help individuals while they are in custody. And then once they're out, they can continue their training with a local university to be able to get these skills. So again, just kind of thinking out of the box about ways that we can start getting these people trained and then getting them into jobs. But this is such a high need position, as you guys saw, especially here in Los Angeles. So this is definitely a great career path for people to get into. So training needed, there on average is about 75 hours of training with like 16 minimum hours of clinical training. Typically, you guys are going to see training for these at like vocational schools, LA Mission College, West LA College. We have a whole list of training partners that we'll also include in the final report and on the 2-pagers. But this training is relatively easy to access for individuals. And then conviction restrictions. So this one, there is licensure restrictions. So serious crimes and or sex offense, which we'll talk about the licensure process here in a little bit. But this one does require an actual license for individuals. So there can be some potential restrictions getting into this. Pay and demand, again, as you guys saw, there's going to be a lot of growth in this area. This wage is the average wage nationwide, which was actually lower than what we heard here in Los Angeles. However, this typically is probably one of the lowest paid clinical positions, but it is a good foot in the door. So people who become CNAs can then move on to LVNs, RNs, and kind of go up the ladder as they wish. They can go into medical assisting, which is not a licensed position. This is kind of a good foot in the door for people. So some of the pros and cons, again, relatively easy training, easily accessible. This is something people can even help out with family. So if they have restrictions to be at home, maybe they have a family member they need to take care of. I know there are things out there where you can actually get paid to help out your own family. You do have to go through a process for that. These are skills that people can do at home or within the industry. Some of the cons is there is the state licensure process. So again, depending on people's convictions, how long it's been, that sort of stuff, which we'll talk about, that can be a potential barrier to this position. So a day in the life, again, it can be in a clinical setting or in a home setting. This is a 24/7, 365-day need. This is, again, individuals who are on hospice, individuals who are recovering from surgeries, who are elderly, infirmed, you know, all sorts of different things. They need these caretakers. One of the employers we spoke to that does typically hire like CNAs and LVNs, they shared that their peak times are during, their non-peak times are during Christmas holiday times and summer, because that's when family members typically are home, whether it's from college or visiting or whatever. However, the rest of the year, then the need kind of skyrockets because then people are back at work, they're not at home, and they need people to take care of people at home. So this is a job that there is a high need. And as you guys saw in LA, the projection over the next 10 years, it's a extremely high need. So this is a great position for your people to kind of start out in. Some possible employers. So there's actually quite a few, but this is just some of the ones that we spoke to that would be open to this. So Antelope Valley Medical Center, City of Hope, Bart's Altadena, APLA Health, AV Care Clinic. City of Hope is going through a lot of expansion right now, including into Orange County. So I know they are hiring a lot. Planned Parenthood is also hiring a lot. Something I neglected to mention also during the hiring need is, I'm sure many of you guys have heard about this, but this was shared by a couple of our employers, that due to LA potentially becoming a sanctuary city for women's reproductive rights is also causing a growth in this need. So a lot of clinics are going to be expanding their care. They're going to be expanding their locations. And so there's going to be a huge need for more employees within this area. So the next kind of entry-level position that we'd recommend people getting into is a medical assistant. So medical assistants are generally cross-trained to perform both administrative and clinical duties, so front and back office duties. Training, needing, and trainers. This is generally like a vocational training certificate and an externship. Those vary depending on what trainer you go with. There's also a certified level of medical assistance. So there's a certificate and there's a certification. The certificate is what the majority of employers require, and that's just the general vocational training. Some do require certified medical assistants, and that's a higher level of medical assistance. Generally, to be certified, you have to work like 2 years experience, and then there's a test that you sit for, and you have to take that test and pass it. For medical assistants, though, like I said, the majority of them are certificated. So if you are seeing ones that are certified, try to identify with an employer. If they tell you we need medical assistants, do you need them to be certificated or certified? Because those are two totally different things when you're getting your clients out there. So conviction restrictions, this one's a little bit different because for the certificate, there is no licensure requirement, since this is then going to be just up to the employer. So this is going to be case by case dependent on the employer's hiring policies. So again, as I shared in the beginning, a lot of employers had shared with us that they truly are following ban the box policies, where they're looking at the candidate as a whole, how long it has been, what is the severity of it. There still is obviously the restriction that once an offer is given, and then they run the background check, if the conviction has something to do with the position, they can then legally obviously not hire the employee. That is still a challenge because that is very subjective, because pretty much any conviction can be substantially related to the healthcare industry. And that is something we heard both from legal attorneys as well as employees, or as employers, I apologize. So this is another reason why it's going to be really important to develop those relationships with the employers, because once they get trust with your organization, with your candidates, they're going to be more apt to be able to look past that to say, hey, you've been working with so-and-so for X amount of time. You vouch for them, right? Like, we're going to be able to take a chance on them. Another thing I neglected to mention with the background checks, several of the employers we spoke to have locations both in clinical settings and in school settings. The ones that have school settings, which means they may have a clinic at like within LAUSD or something like that, those have a much more strict background check requirements. So they require a live scan, and since they're working on campus, with youth or with students, that is a much more difficult process to get through. So I would recommend when you are out targeting employers to see like who to work with, or who would be a good partner. Try to target ones that don't solely have school settings, because those are going to have much higher barriers for us to overcome to get employees placed into them. So pay and demand, this one not specific to LA, but nationwide. This is one of the nation's fastest growing careers. The average pay nationwide, again, is around $21 an hour. We did hear more than that in our screenings. This was a position that on general probably paid around like 23 to 25 to start, which, just so you guys know, it has increased vastly. I placed medical assistants for close to 10 years, probably about 5 years ago I ended. And I remember even just less than 10 years ago, this position was starting about like $11 to $12 an hour. If you got paid 13, that was a lot of money. And so to get in this field. So the fact that it's up to 23 to 25, it's good that they're recognizing the need and the competitiveness for these kind of positions, and that they are paying more. So some of the pros and cons, some of the pros, again, there's no licensure required, so it is a lot less barriers to overcome to get into this field. They do have to complete the training, like I said, and then overcome the employer barriers. They don't have to go through the licensing. Some of the cons is upward mobility can be limited. There is no real career pathway for medical assistants. The majority of employers shared that like the growth for medical assistant is to become a lead. So once you're a medical assistant, you can go on to higher level of medical assistants. You can become certified. You can become a lead. Again, if a person wants to truly advance, they would need to go on and get further schooling or education. So for instance, go on to like an LVN position, move into an RN, but again, they need to go back to school for that. So a day in the life. These are the people when you check into the doctor's office. They're the ones either checking you in at the front desk, or they're the ones that will bring you to the doctor's office. They're the ones that take your weight. They prepare all your charts. They'll take your vitals. They get you all prepped. Why are you here today? For the doctor to come in. They will also give you injections, immunizations, that sort of stuff. So this is a pretty hands-on position. They are literally the assistant. So anything that's needed in the office, they're the ones helping out. Depending on the specialty, there's different things that medical assistants do. But this is kind of like the catch-all position within healthcare. And it is a great entry-level position for people to get into and then continue, like I said, their education or their training to move on into kind of other pathways. So possible employers, this one is pretty much everybody's hiring for this one. And this is what we heard was one of the highest need positions among all the employers we spoke to. Here's just a section of some of the employers that we spoke to that would be open to hiring individuals who are system impacted. Again, all this information also will be included on our the 2-pagers as well, so you guys will have that also. But again, there's a huge need out there. Everyone is hiring for this. This is a very high turnover position. Again, people are job hopping right now, either just due to stress, due to pay. If they can get paid slightly more somewhere else, they're hopping over there. But this is a high need position right now. The last one we're going to talk about is front office and call center. So this position, again, this is people that greet, check-in patients. They could work in a call center environment where they're scheduling, rescheduling appointments, calling for authorizations to check your insurance, all that sort of stuff. These positions, as I just shared with medical assistants, some people can be cross-trained front office. Other places, this can be a completely different position that doesn't require any experience whatsoever. Training needed and trainers. This one, again, is probably one of the easiest ones to get into, but it's also the most competitive. So there's not as high a need with front office positions as medical assisting, but there is generally a need. Majority of what we heard from employers is that they require a diploma, so high school diploma or GED, and then experience in healthcare or customer service. So generally about 6 months within one of these fields. If they do have experience in healthcare, even better. If they're cross-trained as an MA, even better. There can be specific training in ROP or vocational training programs. But again, this is a position somebody probably can walk in and just get hired with no experience. Not to say there's still not competitiveness, right, depending on who's applying to the position, but this definitely has probably the least amount of barriers for training. And generally, again, you would get training on site, so they would train you how to do that. Conviction restrictions, again, no licensure required for this one. This is case by case, depending on the employer's hiring practices. Pay and demand. So there's more call center opportunities than there are front office opportunities. Like I said, for some reason, front office is a challenge to get into. Sometimes because employers have their people cross-trained, so they will hire one MA to do both. So it's not necessarily its own position, but they will hire individuals to get into call center. The good news about call center, especially in my experience placing in this, while typically there's not really upward mobility, like you would go to like a call center lead or like a supervisor, the good news about it is once you kind of have that experience within healthcare, now you know some of the terminology, you know about authorizations, you can move into front office, administrative, billing, coding, scheduling. So there is a whole administrative side, which we didn't really explore in this project. We mainly focused on clinical, but there is a whole administrative side, which also includes teaching, all sorts of stuff on that end, where this call center or front office can kind of be a foot in the door for those kind of positions as well. This one on average, again, the pay was $22 an hour. The reason it has an asterisk is because there isn't like a set in EDD, like medical call center, medical front office. I think the position was like medical schedulers or something. So that's the reason why I had the asterisk. But this position, again, generally pays slightly less than medical assistant, even though this number is slightly higher. But again, it just depends on the clinic that you're kind of getting into. Pros and cons. So again, some of the pros, there's no licensure required. It's very low barrier to be able to get in as far as requirements and experience. Many types of offices need front office workers. So this could be anything from your chiropractor to the hospital, to the emergency room, to everything in between, veterinary offices. I mean, there's a whole spectrum within healthcare, medical sales. There's a whole spectrum, like I said, that we didn't explore in this project, but there is a lot of opportunity for individuals to get in this field. And then, like I said, upward mobility can be limited, just because, like I said, it's not a clear career pathway. Once you're in there to be like, okay, now you're going to go on this field and this field, kind of levels. But again, it does open up doors for other types of positions. So a day in the life, there's generally pretty busy phones, especially right now, as we found. We were on hold for, I can't tell you how long I was on hold for some of these calls. They are very busy right now. Depending on the size of the clinic, or who they're serving, they can be confirming, scheduling, rescheduling appointments. There's generally no direct patient care unless, again, they are cross-trained as an MA. This is also something, though, when you are considering candidates for these kind of positions, really having a true understanding of what that employer needs. So if you have a client who's shy or maybe not, is confident, it may not be a great setting for them to put them smack dab in the middle of the emergency room at USC, right? Like, it's going to be like, it's a very intimidating environment. It's very fast paced. There's a lot of things coming at you. So again, this is where you guys, and again, I know most of you guys in the job development or work field know this already, but truly having a clear understanding of what that looks like. So even call center, are they answering 5 calls a day? Are they answering 5 calls a minute, right? Like, what does that look like? And is your client going to be able to be successful in that environment? Because it can be a very intimidating environment. However, some people do like it because, especially in a call center, you're not working directly with patients, which can be intimidating. And I think we all know patients and people in general can be challenging sometimes. And so if you don't have that, that kind of wherewithal, right, to be able to respond to somebody who's angry, upset, sick, that could be a challenge for somebody who maybe doesn't have those skills, those behavioral skills yet, to put them in that environment. So again, just really understanding the needs of that clinic. If it's a slow chiropractor's office where, 5 people come in a day, you're just kind of leisurely answering phones and scheduling, that may be a totally different environment for somebody to work in. Some possible employers, again, we did hear from the majority of the community clinics out there, Planned Parenthood. There was, again, several of these. It wasn't as high a need as the other positions, but there's definitely need out there. Okay, so I'm talking a lot. Hold on here.
Doing great, Megan. I'll just flag, there's a couple of questions in the chat. Do you want me to raise them now, or do you want to wait?
If you can, because I can't see the chat, I apologize.
No worries. So going back to some of what the employers shared with you during phase 1 and 2, Miguel asked, any information about the types of convictions that would not be considered? Did employers sort of name specific types of convictions?
Yes, and so we'll talk about some of that here in the occupational licensing. However, with that, honestly, every employer was different. We had some employers that said the more severe ones, right? If it was like violent or sex crimes, they wouldn't consider that. We had one who, while I was appreciative of them, I almost was kind of like, okay, what do you hire for? Because they gave me a whole laundry list of all these things that they don't hire for, or they wouldn't consider. And that could be anything from like drug possession, to all the way on up. Or I know there was one in particular, we asked what sort of convictions would you hire for? And they're like, oh yeah, we would consider people, with convictions. And so when we started probing, asking like, what convictions would you or would you not consider? Oh, we would consider like a DUI or like a petty theft. And I was like, okay, that's like 2 things out of like the whole penal system here. So again, that's really important too when you're talking to your employers, not just asking if they run background checks, right? But really asking what is or isn't permissible. And the reason how I used to tee that out with employers was saying, I want to make sure obviously my clients are successful out there, and I don't want to send you somebody who's not going to be considered for a position. And so just really having a true understanding of what those limitations are. I'll be honest that we weren't able to gather super in-depth detail information on that due to the nature of kind of our relationship building in that first phase. Like I said, a lot of them just kind of gave us generic HR answers, like we would consider somebody, and it was like, would they not? We don't really know. So that's something, again, to dig. However, like I said, there were several that said, if it's something that was more than 7 years ago, et cetera, like, again, we don't look at that. We don't consider that, right? So they are looking at the true background check. But that one honestly was like kind of like it ran the gambit of what we heard from people.
Thanks, Megan. And then the second question I see in the chat is from Frank, from ACE. I understand that biotech, looking at the sort of clusters, has stricter conviction screenings. Did you find the same thing?
Yeah, so within biotech, the reason the stricter is in there is a lot of those are licensure positions. So within the licensure, again, it is more challenging, which actually we'll talk about right now. So yes, however, we didn't talk to a lot of biotech employers because we were talking more clinical. So I didn't get like a deep dive on that. But depending on obviously what they're doing, if they have government contracts, we did also learn that some with federal funding also comes restrictions. So some of these healthcare employers, if they're federally funded, there's actual restrictions from the federal side that they can or can't hire people. So that's where their restrictions are coming in. So again, it's just really getting to know these employers and finding out kind of what their restrictions are. Is that it? All right.
Yep, that's it.
Perfect. And I apologize I can't see them, but I will answer all the questions. So occupational licensing, as you guys heard, some of the positions need it, some do not. Historically, there has been a lot of barriers to occupational licensing. So this has been a huge restriction for people to even apply. And I think this is where a lot of like the miscommunication has come, that people think that they can't apply to these type of positions. So there have been some recent laws that have passed that are helping to reduce these barriers. However, timing wise, when a lot of these passed or went into action was right in the beginning of 2020. And I think we all know what happened in 2020. And healthcare has just been holding on for dear life ever since then. So I don't think even a lot of them are fully aware of some of these restrictions or laws that are happening. So again, this comes in where kind of that education process is going to be key. So in 2014, Governor Jerry Brown signed SB 1384, which eliminated automatic denials of applications for CNA licensure specifically. And what this did was help open the door for primarily women. This is a position that is primarily worked by women, and more specifically, lower income women of color. And they were finding that this was a huge barrier for women to get into this field when there was just an automatic denial for them to even apply. And now once they lowered this barrier for them, they're starting to see more people get in and get licensure that may have those DUIs or petty crimes or kind of lower level crimes. So again, this bill has really opened the gate for people to at least be considered for these kind of positions. In 2018, Assembly Bill 2138 passed. So this one was kind of an extension on SB 1384. So this one, and again, I'll talk a little bit more about these and kind of what all the barriers are. But this one just helps, again, lower those restrictions. So now for almost all of the licensing boards, which includes healthcare, the ones that it doesn't include is like racing and betting and some other ones that we're not focusing on. But for our purposes, it now takes away, again, kind of that box on the application process. So they can't ask upfront about your convictions. They don't run background checks in the way they used to. Now it's off of a fingerprint. So there's a process with that, which we'll talk about here. But again, it just kind of helps lower those barriers for individuals to actually get a foot into this. This bill, this is the one that went into action in 2020. So again, this one I think is still relatively new. And that's another reason why I think there hasn't been like a lot of people even applying for licensure, because again, I don't think people are aware of it out there. And then the newest one, which some of you guys may be more familiar with than I am at this point, but AB 1076, which is the new expungement law. So this says that anyone who receives a new conviction after January 1st will have their records sealed and expunged automatically at the time point after they've, completed all their requirements, that sort of stuff. And the reason this one helped gain traction also is, again, to help reduce barriers for individuals who may have not been able to afford expungement or dismissals. They may have not even known it existed. They may not want to go through the process of it, anything like that. And so this actually helps where those the individuals who qualify for this, their record will be sealed and expunged. There are still certain requirements or things out there that people can still review these records. So for instance, for licensure, for government jobs, the DA. So if they were going to prosecute this person for another conviction, they can still look at those. But again, it just helps when you are applying for employment to automatically kind of have that off your record so you have a fairer chance at employing. So the licensure process. So again, initially you guys got to complete that required training. So as we kind of talked about, each one has their own specific training, whether it's CN or CNA, LVN, etc. They apply for licensure. Each type of licensure board is a different process. So again, with the SB 2138 passing, it's now a fingerprint process. So individuals can apply. It's a fingerprint background. We'll go through that here in a second. But each position is different. So if you're an LVN and you get licensed and now you become an RN, you got to go through the whole process all over again. The other thing, because it's a different board, the other thing to keep in mind is these boards do not share information. So when we talk about some of this application right now and what to have or don't have, keep in mind you have to do the whole thing all over again for the new board because they do not share records or anything like that. Anyone who applies for licensure who has a background, it doesn't matter what it is or how long ago it was, they will be referred to what's called the enforcement division. What they consider, so anything that's a criminal conviction, so any misdemeanors, felonies, pleas of no contest, military convictions, if you were under 18 but tried as an adult, or even disciplined by another state licensing agency, you will get referred to the enforcement division. It doesn't matter how long ago it was or anything like that, they automatically will get kicked out to the enforcement division. So once you're in the enforcement division, what they do is they are now going to review the application of the applicant. They now are going to request certified arrest and court records. They're going to request arrest records. They're going to request pretty much all the records. To help speed up this process, you guys are going to want to front load these applications. When your client actually applies for licensure, you want to front load the application with all these documents ahead of time. So that way it's going to help speed up the process of the board's decision. Prior to 2020, this whole process took about 2 weeks. Now the process takes, even if you have all the documents attached, about 80% of them are still happening within with about like 4 weeks for that. So it's a little bit longer process, even if you have all the documents. If you don't have the documents, it's going to be an even longer process. The other thing you want to front load the application with is anything that shows positive for your client. So any certificates they've completed, schooling they've completed, letters of recommendation, if they've worked within healthcare previously, any performance reviews, anything like that, you want to front load the application so that way they have it. The client is still going to get referred to the enforcement review, but it's going to cut down the process of the time that it takes to review. Once they're in this enforcement review, one of two things are going to happen. They're either going to get approved. The vast majority of applications will get approved, and that can take less than 30 days. If the client is approved, they'll get a letter in the mail that says, congratulations, you are approved. There are ones that are denied. Typically, ones that are denied are individuals with serious crimes. So this is anything like violent crimes, murder, rape, sex offenses that require tier 2 or tier 3 registration. Those ones are definitely going to get denied. Those are going to go automatically to the denials, which are referred now to the discipline unit. And so what that means, so in between that, if you are denied licensure, there's a few things that you can do. The board will present you with a letter on what you're supposed to do. So they're going to tell you how to appeal, where to appeal, and what you need to do. They're going to tell you that you can request a copy of the history. I recommend everyone request a copy of this history because what the background check that the board runs and the enforcement division runs does not include any dismissals, pardons, expungements, anything like that. It doesn't include any of those. So this is the option for you and the client to review it and say, this is correct or this is not correct. And if it's not correct, then supply the supporting documentation for it, which again is why I said front load the application so that way they already have it. But if they don't have it, this is your chance to supply it. They can then review it. They will then decide to continue to deny the application. where you can go for an appeal. Or again, they could then fix the application saying, oh, oops, that was missing. We fixed it. It's now going to be approved. So if it is we reviewed the history, it's correct. We are going to now appeal. So what's going to happen is your case is going to get transmitted to the Attorney General's office. You're going to get assigned Deputy AG. They're going to prepare the case. You have the chance to go before a administrative law judge. A client has the opportunity to have legal representation or not. As with anything, we always recommend to try to have legal representation if you can. They can help put together witnesses, supplying documents, anything that's going to show this candidate's rehabilitation. And they're going to be able to present that at the hearing to the administrative law judge. Depending on the board that they're applying to, the administrative law judge has 30, 60, or 100 days after the hearing to make a decision. Once that administrative law judge makes a decision, they forward it to the board. The board then has the ultimate decision to say yay or nay on this individual. If the individual gets approved, they'll get a letter in the mail. Here's your licensure. You got licensed. If they get denied, that's usually the final. If they do get denied for some reason, what I understand from this is those final denials are rare if you have gone this far and you've gone through the whole process. However, they can still happen, again, depending on the time of your conviction, anything like that. So this is something we recommend, and I think I'll put it in the recommendations, or it is in the recommendations, is prior to even starting this process, try to get your client to already dismiss their case if they can, apply to a pardon, do research if this is even going to be something they're going to be able to do, because you don't want the client to go through this whole process to end up getting denied. Something I also forgot to mention, something that is not considered, is back child support. So if you have a client who owes back child support, that is not something you have to disclose. However, if the case is with the district attorney, already filed as saying that they're, in default, they owe child support, what happens is the candidate will be issued a temporary licensure for 150 days. Within that 150 days, they have to set up a payment plan for their child support. If they don't, at the end of that, their license will be suspended. However, that is something that will not kick them out or be denied, but it is something they will get a temporary status until they can get on board for that. So again, just something else, try to take care of all those fees and fines prior to even applying for this process. Those help cut down time. So recommendations, again, as I just said, I definitely recommend obtaining clearance before even applying for the occupational licensing, researching the official license that the person is trying to apply for, and their specific record to determine if they even meet needs or they would qualify for this. Before they spend money on training, advise a person to pay fines, fees, and restitution. I have a recent story. So I wear many hats out there, but I do work directly with clients as well, helping them get employment. And this literally happened 2 weeks ago. I have a woman who previously worked in healthcare. She unfortunately got a pretty severe case. She was under the influence of medication. She had her child in the car, so she ended up with child endangerment. Driving under the influence, all these other things. She's completed all of her classes that she needed to do. She got her child back. She's been taking classes to get back into healthcare. She got an interview the other day. We were so excited, hey, this could happen. They can hire you. And she got turned down. And the reason she got turned down was not because of her background. She got turned down because she still owes $600 because of the DUI to get her license back. So again, it's so important that you guys make sure the person pays any fines, fees, and restitution, because even if an employer may consider them because of their rehabilitation, because of their background, that's all okay, they can still get turned down for employment because they owe fines, fees, or restitution. So again, just making sure they're in good standing and trying to get those paid down first before they do apply for any of this stuff. And then obviously goes without saying, but avoid any new convictions, right? So if your person does have a current case, try to seek diversion or deferred entry of judgment when possible. So that way, again, they're not getting that new conviction on their record and hopefully have a better chance of obtaining employment within this field. So on the placement side, as I've been sharing throughout, be persistent. Like I said, as you guys heard, we had about 234 contacts, ended up doing screenings with about 38 of them, which is a relatively small percentage compared to how this used to be, even say 10 years ago, right? Trying to get contacts within the healthcare industry. So it is going to take persistence to develop those relationships with them, selling them on why it's important to work with you and your organization. What do you guys offer? One of the main things we heard from employers when we asked, what sort of skills are you looking for? It wasn't, I'm looking for the best MA who can give the best injections or, whatever else. The main things we heard was we need people who can show up on time and are willing to work. And so again, those are kind of behaviors that you guys can help work with your clients prior to getting to the employment. The employer said, we can teach them. We can teach them whatever we need to teach them, but we can't teach them to show up on time. We can't teach them to have a good attitude, or be ready to work. So again, selling kind of those skills, why are your candidates going to make good fits? Do your research on the employer. So again, the type of employer, is it high volume, lower volume? Who do they work with? Are they on the school sites? Do they have clinics, mobile clinics? Do they have positions like community health workers, which typically are a position that individuals with backgrounds can get into? Do they have these kind of positions to help people get a foot in the door? Again, identifying right fit candidates. So I kind of talked about that earlier as well. So again, I have a super shy candidate. Am I going to put them at the front of the emergency room doing intakes? Probably not, not necessarily a good fit for them. But just really doing that employee matching, understanding the true needs of the employer and then the true needs of your client. So again, I know most of you guys are in this field, so I'm preaching to the choir. But does that employer, do they require a lot of overtime? Does my client have childcare and they can't work overtime, right? Is that not going to be a good fit for them? Does my client need a little bit more coaching? I had a gentleman I worked with years ago who had, he had learning disabilities. And I ended up placing him in a billing and coding office, and they adored him. And the reason is because that job is very monotonous. It's the same thing every single day. This gentleman, he had autism. He loved it. He put his little sticky notes, here's step 1, step 2, step 3, and he just did this all day long. Like, he was super successful. So again, just making sure that you're really matching your clients up with the right position based on their needs. Another big opportunity is developing internship and or externship opportunities. So with the training partners that have to do the hands-on training, so for instance, for medical assisting, an opportunity is to work with the training partner and the employer. So it's kind of like a try before you buy, right? Where your candidate can go get their hands-on training there. They get exposure to the employer. The employer can see them ahead of time and say, you know what, I already like that person. I can possibly overlook, their convictions or whatever else it is. Another opportunity, like I said, is the internship side. This is something I developed years ago with a large healthcare employer. We did it on the administrative side, where we developed a internship in their billing administrative office. And so HR was aware that they had individuals that were coming in with backgrounds no one else did. This was a place that typically would not hire people with backgrounds, but due to our program, it has such a good reputation that they hired our candidates. Several of our candidates have now moved up within that organization. I have supply chain managers over there, all sorts of other things. So again, any way that you can get a foot in the door for your clients is going to be beneficial. Working with the training facility and employer to ensure skills match needs. So making sure your candidates are the first choice. So you'll hear time and time again from employers that are like, candidates don't know how to do XYZ. So I'll just use medical assistants as an example. During COVID, a lot of medical assistants in training suffered because they were doing virtual training. And a big piece of medical assistant training is doing injections. If you're doing injections at home on an orange or a potato, that's totally different from doing injections on a small child, right? Who is squirming and screaming and doesn't want to be there. So those candidates came in, they were trained, they got their approvals, but now going into hands-on experience, that's a skill that's missing. So this is something you guys can work with the training facilities to ensure whatever skill that the employer is missing, that they are truly training your candidates. So your candidates are coming out kind of like top of the bunch. And then also working with the training partners to help candidates move up. Something else we heard from employers was that there was no true career pathway for individuals to move up in the industry. And one employer in particular had shared, we would love people to move up. However, we don't do a good job internally of actually matching them with skills training. So this is a great opportunity for you guys to come in and say, hey, I know so-and-so's been working there X amount of time. We're now going to work with this training partner to be able to get them their next level of skills to move up in the company. And now what you can do is now backfill the position they moved out of with your next candidate coming in. So again, just really utilizing those training partners and the employers to really fill the needs of all of them. And training partners, they need training, they need trainees right now. So I know they're all open also. If you have a pipeline of people that are coming in, they're going to want to work with you guys.
I just want to ask everyone to please mute unless you're speaking. And just so you know, Megan, I think you can actually mute people as the owner of
I was going to say, I don't know.
You just click on their names and mute them.
Yeah, the facilitator can mute people.
Pancake wings.
I don't see which one
too
it
nice,
is, though.
too fat, too greedy. Call me whatever you want, but word this is and tell $sign means they're different.
If you make me
So we get
co-host,
you
I can
a
do
little
it.
bit of kosher salt, some garlic powder, some honey powder, a little bit of white pepper.
Here we go. Okay. You got it. I found it. I almost needed you, Jessica. Okay. Yeah, so that was pretty much it. In the report, we are going to have some more recommendations. Another recommendation I would use as well is using people who can speak on your behalf. So this is something that was important when we did our employer presentation. We actually had individuals come in who are system impacted, who are currently working in healthcare, share their stories and share what they're currently doing, which is very impactful. Something else that's impactful is once you get an employer that is working with individuals who are system impacted, using that employer to talk to the other employer, because once they can kind of talk to them and share what are their, what were their concerns? What do they do? How are they overcoming it? It's very impactful. So I definitely recommend utilizing stories. You guys would be surprised how many individuals actually work in this field who have backgrounds and are kind of under the radar. So that was another study that was done actually within clinical healthcare facilities, so senior facilities, where they did a just kind of random sampling across the nation. And they actually found that like 1 in 5 employees had a background working in this field. And that was something that wasn't necessarily advertised or known, but there are people out there working. So just identifying who those people are, and if you can get them to share their stories, is also going to be impactful for employers. So open it up for questions, and then we're going to have a little bit of time for like peer learning, and kind of hear from you guys too, and what you guys have seen or what your experiences are. So any more questions? Jess, I can't see the chat.
There's no questions in the chat. I think you were very effective in answering people's questions. So maybe we can move to the peer learning, and if questions come out through that.
Perfect. So peer learning, we were just going to throw this out to you guys, because again, I'm not sure, to be honest, who's all in the room either. If any of you guys are currently working in healthcare employment or placing people within healthcare employment. And so if so, we just want to kind of find out, like, what trends are you seeing? Are people getting employed? Are there still barriers? Are you aware of any current successful partnerships that already exist specific to clinical positions? Because that could be something that's helpful right now. What interest are you seeing from clients? What concerns do you have? We just want to hear from you guys right now. So kind of what are you guys seeing or hearing out there? Or even like, why did you come today? Like, why is this interesting to you guys to learn about this? So,
and I'm not above calling on people, because I see a lot of really cool people in the room that I think would have really good insights on this. So we'll give it a couple minutes.
Yeah, if you don't mind, I could unmute myself. This is Frank Alvarez, Director of Training at ACE. We've had opportunity to enroll some of our trainees into biotech manufacturing, but there was some hesitation on the training providers end because of the employers. So
Okay.
Just interested if you're able to make any progress around that, identify some employers, because that would be something we're interested in. And I think just our general interest in healthcare is just to identify those opportunities for folks with backgrounds, and so who are the employers we can engage with, and then what are going to be the what certifications or credentials are recognized in the industry, right? So whether if that It's my understanding if say we send someone to Mission College and they go through the Certificate of Achievement program, that's recognized by the state of California. So that should be recognized by local employers versus sending somebody to American Career College or any one of these number of private nurse, CNA, vocational, because there's a number of them out there in the community, right? And so just trying to filter through that.
Yeah, definitely. And so kind of twofold answer on that. So as I had shared, like we didn't necessarily delve into like the biotech kind of manufacturing side of things. We were in clinical. But I would definitely recommend like asking the employers, right? Like what are their restrictions? Because if it is kind of more on the manufacturing side, there shouldn't be as many restrictions. And so maybe that comes into like employer education as far as what are their hiring policies, that sort of stuff. And then you made a good point on the training partners as well. So just because a training partner is an accredited or recognized training place doesn't mean the employers want to hire people from that place either. So we even heard that. So there was one employer in particular, we asked them, like, are there any training partners that you prefer over others? And one in particular had mentioned like they work specifically with like UCLA and Charles Drew University for clients. So this is why I said it's kind of like and you guys, it's gonna be kind of a jigsaw puzzle, right? So talking to the employers, finding out what training partners you prefer, and then creating a relationship with those training partners. So that way your clients do have a foot in the door, right? Because then we don't want to have them paying a ton of money if that's not gonna be a good opportunity. One of the main training partners we spoke to and had created a relationship with ODR was the LA Unified School District, their CTE program, so their allied healthcare programs. They teach medical assisting, CNA, LVNs, like pretty much the gamut of things, and they're all over the place. It is a mostly free program to enter. Again, people have to pay for like books and sometimes your certifications, that sort of stuff. But it's a great opportunity for training. They were open and willing to work with sector partners, with other partners. They currently have relationships in other industries, so not in allied health, but in other industries with reentry service providers in LA. So again, trying to identify some of those training partners. And then you can even talk to them. Hey, where are your externship sites? Where are you placing people as employers? And if that matches up with your employers, great. And if not, then maybe make a relationship with those employers. That way your candidates do have a better chance of getting in there. So hopefully that helps. But yes, definitely great concerns and great points on them. And then Sean, I think you have your hand up.
Yes. First of all, thank you for a great presentation. Appreciate this. I'm wondering if similar, informationals or workshops like this is happening with employers as well. I think oftentimes, those of us as service providers, we know all of the information and we are part of passing all of the, new legislation that, restricts how backgrounds can be used, but the message doesn't always go out to the employers, right? Or even the licensing board sometime, or at least they don't enforce it. So I'm wondering if there's something that has already been done, or if there's a way to maybe work with the chamber or some way to also educate employers. I know many of us can attest, we get this information fired up. We get people, who are ready to go, who are trained and excited, and then we run into the type of hurdles that you have listed, or we still deal with the blanket, understanding that, you can't work in the field. So I guess to boil that down and land this plane, are there any trainings that have happened or planned to happen with employers to make them aware? And if so, what type of partnership could those of us that are service providers plan or support?
Yeah, so I can answer probably the first part of that and just maybe able to chime in on kind of like extra work that's happening. But yes, I mean, you hit the nail on the head. And I think that was the whole reason that like ODR actually started this project to begin with, right? Was to find out what's out there and what are those relationships. So we did in phase 2, we did do that, the employer workshop where, like I said, we invited the employers. We actually talked to them about fair chance hiring. What are the benefits? What are the constraints? Asking about their concerns. And then we did a follow-up one-on-one, what we called kind of coaching session with employers and with ODR, twofold. One, to answer any other questions, and then 2, to start doing that handoff relationship with ODR and finding out what is it going to take to get you to be a partner, right? And what we did here from kind of the small sampling that we had was that they were open. And so some of them would come and be open to talking to sector partners about, kind of what are their needs. We're trying to be very careful because, as I said, their time is very of the essence right now. It's very difficult to even get them in some of these conversations. So trying to think of creative ways, such as like maybe recording them talking about their needs to present to sector, right? Or having that one path through ODR. So through Jessica and Patty, their office, to kind of have that connection to employers. But if we can start with some of those employers, then using those employers to start talking to the other ones. That said, though, there is still a lot of need beyond this project, as you guys heard throughout, for community education on all ends. So training, boards, occupational licensing, employers. So again, that's a much bigger project, which Jessica may be able to talk about as well. But yes, so we have started kind of that legwork, though, to at least start engaging the employers and really getting them to commit to saying, yes, I will hire these individuals.
Yeah, and I'll just tack on a little bit, which is to say, because this project with Prop 47 funded, the primary objective needs to be focused on the sector program. So that's been sort of the framing. That being said, we wanted this and our other tech program, which the presentation is coming up December 12th. You'll hear about that, to benefit the wider community. And so Patty Conklin, who's on this call, is our employer engagement coordinator. We also hired into our team to do some of this follow-up work. So as Megan's contract ends, Patty's sort of trying to follow up with those employers that were identified. But our hope is for this to obviously we start with the program that we're working on, but it's something that applies to so many of us. And that's why, even in this room, right, we have folks from the HR department in the county, we have people from DEO, Jericho Center, there's all of these folks in the room. And we do want to make sure that if there are creative ideas, and that's part of why we wanted to have peer learning in this space, is to have a space to hear, okay, this is great. Here's how it ties into what we're doing. Here's how we can collaborate, so that we can be thoughtful about that.
Thanks, Jessica. I think that would be helpful, even if there is a conversation between employers and service providers. We understand that, we don't want to waste their time nor ours. But I know oftentimes who you're meeting with can be removed from the HR department. And so they're not even aware of some of the hurdles that, people may be experiencing trying to get with them. And so I think that conversation, it creates the relationship that allows us to build that pipeline that's necessary. It allows us to understand what they're looking for, both soft skill as well as technical training. And then it kind of takes some of the spookiness out of working with those people, right? And so I think that would be a great next step, whether it's specific to the sector program or goes, outside, to have a conversation so that employers can meet with the people who are preparing their workforce and hear some of the obstacles that are faced, which they may not even be aware of happening.
Thanks, Sean.
That's such a wonderful comment. Really, that's well thought out. And just to say to refer back to what Jessica said, I am meeting with some medical clients that we've identified, and we're just beginning the process. And so once that process gets further down the road, we'll be communicating more.
Thank you.
Thank you. And Alex, do you have a question?
Yes. Hi, Megan.
Hi.
I don't know if you recognize me without red hair.
Of course.
Thank you. Wonderful presentation today. I'm so glad to have made it. Thank you. I just wanted to say the interest that we're seeing from our clients is primarily in drug treatment and the community healthcare worker space, social service related to healthcare. And that leads me to, after hearing Sean, think about when we're meeting with employers or HR, and if further down the line there's some kind of meet and greet or a career fair, that we really educate other healthcare providers how valuable our people are in the current healthcare industries that predominantly hires our people, and how could we showcase that to the people in HR and that do the hiring and set those policies to show that we are valuable in this space. So just a thought for further down. I know that takes much more planning than today. And one last thing, the customer service. Oh my gosh. Okay, I'm in the hands of a few healthcare providers, and the people on the phone are terrible. And I just know we can come to the table with much
Yes.
better customer service than what's out there. I feel like we ought to be able to just blow right through the people that are answering those phones. That's just my thought. But thank you. And I look forward to participating in anything else to move this, the needle further along. So thanks, Jessica and ODR, and thanks, Megan.
Thank you. No, and thanks for that feedback. And to chime in, not to knock anybody, because like I said, they are understaffed, but we definitely experienced what you were talking about on the phone. I mean, I've experienced personally, even calling and getting run around, but definitely this project. And so there was a gambit of people answering the phones, and going back to, again, a lot of them are really understaffed, overworked right now, that sort of stuff. But I think that is a key area that you can definitely train people in. And then regarding like the drug treatment and like community health workers, we didn't touch on that so much in this presentation or project, because that is already an avenue that individuals are getting hired into. So we figured obviously that's not something we need to do too much work on. However, on the community health worker, something that we did here that is good to share, that is a position that is now recently going to be funded by insurance companies, meaning there's going to be an even bigger need within the healthcare industry. So previously that was kind of like an add-on position for healthcare, clinics. But now that they're actually getting reimbursed for it, they're going to start adding more of those positions. There's an even bigger need that we heard, especially due to COVID-19 and outreach for vaccinations, boosters, et cetera, to certain populations. So obviously having individuals from those communities that are able to go out and do that outreach. So that is a huge need right now in the community. So those that are not aware, that is definitely a position that does hire system impacted people. There are already several organizations in LA County that are doing training and placement in those areas. And so if you guys want to learn more, obviously kind of connect with those organizations and stuff. But yes, that, and then drug treatment. I know that's another area where people are really, who are system impacted or wanting to like give back. So they're like, how can I give back, and getting certified in those areas. So that is another growing need also. Any other questions or comments?
I think I want to sort of just ask, particularly maybe some of our friends from DEO or inside of the county, to Alex and Sean's point of sort of the continuation of this project, because to be totally transparent, right, this was a short-term contract, and the final report and those handouts that Megan presented on, that's sort of the final deliverable. And then we are going to have to take up the continuity from there. And so our intention is to, obviously Patty's going to continue to be doing the work, connecting directly with the employers and connecting that back into our sector program specifically. But in terms of wider programming, I know that DEO has sort of high road partnerships development. I know that you all have different work with like the LARP Employment Committee, whatever. I'm curious to hear, after hearing this presentation, what are the current partnerships, if any, and I'm thinking of our work friends here too, like in healthcare, that have been particularly successful, and what did you attribute that to? If anybody wants to share concrete examples.
Jessica, I'm happy to share. This is Cassie Stevens from Worker Education and Resource Center. Honestly, I think our biggest success is working with the county. We help with EBS workers, also some of their intermediate clerical positions, so a bit on that administrative side for healthcare. We also ran programming for sort of residential aid positions and case manager positions in some healthcare agencies, and there was less openness, right, to individuals with backgrounds than our experience in working with the county. So we've had a lot of success with the public sector. I think in general, we found HR folks are very open and sort of amenable. And so I'd say sort of the biggest lesson learned from us in navigating with all the different employer partners is, yes, human resources has to go through their steps, and bringing all that information up front is very helpful. But that follow-up and advocacy on the back end, even once the background check comes up, we've had a lot of success in advocating and negotiating with HR, and having employer partners sort of take a risk sometimes. And so you know, I think you guys both shared a lot, that employer relationship is so foundational. And how can you, Megan, I appreciated you said, building it a sort of wide and deep net with our employer partners, because we're seeing that too. We're experiencing so many folks coming in and out. So how can we make a sustainable employer relationship? So, and again, and I appreciate the other comments on the call too, about just working and educating our employer partners. Because like I said, I'm seeing it very fruitfully in public service, but how can we continue in both our private and other community-based sectors throughout the county?
Yeah, no, thank you for that. And it's glad to hear that that work is going on currently, even on a smaller level. That's another point another point I think I didn't make is we didn't fully explore like DHS or kind of like the county or government. We were mainly looking at, you know, the private employers as well. So I know there already is some success going on, but to everyone's point, yeah, there's still a lot of need for education within kind of the private sector also.
And, you know, I'd like to also add that I work at LA County DEO, and we do have a program that's geared towards hiring for homeless and reentry individuals. And in the healthcare, one healthcare agency that's become a great partner is Tarzana Treatment Center. And so they've hired several individuals from our Careers for a Cause program. And also, as we're expanding into Antelope Valley College, we're going to develop a relationship with Tarzana Treatment Center in their area. Also, St. Joseph also is willing to hire folks for certain positions that have reentry. Also, St. John's. So those are healthcare industries, but it's different positions, and from peer specialist or and to be honest, I can't say what the reentry background is, or the I'm looking for a word, but anyway, we don't know the background specifically. I can't say that. That's up to the participant to disclose when they're getting hired, if it's requested. But I just know that some of the positions are peer specialists. There's also peer outreach, which is more in the field work. And also we had a couple of individuals that received positions as security officers at some healthcare agencies. So it wasn't like it was a hand-on caseload, you know, sensitive services, but they were able to hire them. And so that's been our experience working for my program anyhow with Careers for a Cause. So most of the other reentry, has been through connections built with homeless services agencies. We've been able to tap into some of the folks that are getting Measure H funding, and they're a little bit more apt and understanding with hiring folks that are both homeless and reentry.
And Jessica, I just want to add one thing is just if everybody knows, because we know about the Tarzana, what Megan was referring to about the Medi-Cal or Medicaid paying for a new service is the peer mentor
Peer support
specialist.
role.
Yeah, that just started training at Tarzana and it's going to be throughout the state. It's a licensing training. And I think they're full right now, but I think they're starting a waiting list because they are going to continue. It's going to become a requirement for many places to have that position. So I think there's going to be a lot of opportunities in that area coming up. And then they have supervisor training, and there's different levels of training, but you have to go for the first training first. And then, so it's going to be a real opening in the healthcare system in that area.
Great, thanks, Patty. And I'm seeing some of the notes here just in the chat, just to bring them up. Vanessa highlighting that you know, we've contracted with so many of those wonderful organizations, Tisha, you were naming for our reentry intensive case management service program that hire community health workers with experience that work, also does certified peer support specialist trainings, and that Alex has had success with getting folks hired at Tarzana that did the PSSS. Any last words, Megan? I want to thank you so much for this really wonderful presentation. It sounds like it was a helpful one for many of us, and we'll be following up. Any final words?
No, just thank you guys all. On my end, this has been very interesting because again, as I shared, I work directly in this as well. And so I'm excited for this research, and hopefully sharing with you guys, we will start opening up more opportunities for our clients. And so as I shared, our report will be coming out with the flyers and stuff. And so hopefully that's useful too for you guys. So thank you guys for coming and then sharing your input and all of that. And yeah, I look forward to hearing successes on the outside.
Thank you so much. And to everyone here, feel free to share any feedback you have about this session or follow-up thoughts or collaborative ideas with me. We'll be continuing to think about this clinical workforce space. So thank you all for your time. Thank you, Megan, for your presentation.
Thank you.